It being 11:01 a.m., the House will now proceed to the consideration of private members' business as listed on today's order paper.
Private members' business, consideration of motion M174, National Suicide Prevention Action Plan, standing in the name of Mr. Angus.
Mr. Angus, seconded by Mr. Benson, moves that in the opinion of the House, the government should A, establish a National Suicide Prevention Action Plan, including among its provisions, 1, commitment to the actions and resources required to establish culturally appropriate, community-based suicide prevention programs as articulated by representative organizations of the Inuit, First Nations, and Métis peoples. 2, establishment of national guidelines for best practices in suicide prevention based on evidence of effectiveness in a Canadian context. 3, the creation of a national public health monitoring program for the prevention of suicide and identification of groups at elevated risk. 4, creation of programs to identify and to attempt to fill gaps in knowledge relating to suicide and its prevention, including timely and accurate statistical data. 5, development of tools to promote responsible and safe reporting of suicide and its prevention by media. 6, establishment of national standards for the training of persons engaged in suicide prevention, whose contact with potentially vulnerable populations provides an opportunity to identify at-risk individuals and direct them to appropriate assessment and treatment. 7, creation of a national online hub providing essential information and guides to accessing services in English, French, selected Indigenous languages, and other languages spoken widely in Canada for suicidal individuals, their families and friends, people bereaved by a loved one's suicide, workplaces and other stakeholders concerned with suicide prevention. 8, conducting within 18 months comprehensive analyses of high-risk groups of people and the risk factors specific to each such group, the degree to which child sexual abuse and other forms of childhood abuse and neglect have an impact on suicidal behavior, the barriers to Canadians accessing appropriate and adequate health, wellness, and recovery services, including substance use, addiction, and bereavement services, the funding arrangements required to provide the treatment, education, professional training, and other supports required to prevent suicide and assist those bereaved by a loved one's suicide, the use of culturally appropriate suicide prevention activities and best practices, the role that social media plays with respect to suicide and suicide prevention, means to reduce stigma associated with being a consumer of mental health, bereavement, and other associated services, and ways in which society can reduce access to means and methods for people to harm themselves, and B, report to Parliament annually on preparations for and implementation of the National Action Plan for Suicide Prevention, including data on progress over the previous year and a comprehensive statistical overview of suicide in Canada for the same year. Debate. The Honourable Member for Timmins-James-Baie.
Thank you, Mr. Speaker. Je suis très fier d'avoir l'opportunité.
Mr. Speaker, I'm very proud to have the opportunity this morning to present this plan and to talk about the necessity of a national suicide prevention plan. This is my first debate in this new chamber, and it is an opportunity for all of us to work together and to do things right in order to help deal with the suicide crisis.
Honored I am to be rising in this new chamber, this new parliament that was smudged by Claudette Commanda of the Algonquin Nation, the first time in any legislature in any nation that we would begin this new parliament with a sense of hope and a sense of commitment to make change. And so for me to be given my first opportunity to speak on a matter as important as this, I take very seriously. I also think back to one of the first debates we had in this 42nd Parliament. It was a debate, it was a common discussion during the Attawapiskat suicide crisis in 2012. And what a powerful moment that was for this Parliament, because we came together. The problem is that the deaths continue, and good words alone will not change the reality unless we come together to recognize the role that the federal government has to play. Je voudrais dire, Monsieur le Président,
Mr. Speaker, I'd like to say that it is possible for Canada to find a way, because Quebec for over 20 years has a plan in order to reduce the number of suicides, and this plan and its results are extraordinary. They have truly reduced the number of suicides in Quebec by 40%. Imagine the benefits it would accrue if Ottawa were to adopt a plan like Quebec's and make it a national plan.
Suicide touches every one of us. It touches all our communities. It touches across age groups. It touches across race. I come at this issue, Mr. Speaker, from the experience that I've seen in the communities of the far north, coming through one horrific crisis after another and realizing that without the support of a coherent strategy, children needlessly died and will continue to die unless we change. And I want to point out, I was just recently at Northern Lights Secondary School in the James-Baie, and I walked into that school and I saw a school of hope. I saw young people engaged. I saw them playing music. I could feel it in the halls, that sense of determination and a future. And I remember being there 10 years ago in the middle of the suicide crisis, when the trauma that I saw on the faces of the first responders and the family, because children were dying not singly but in twos and threes. And at that time there was nobody from the federal or provincial government, no department helping out. And Ron Pate, who was the high school principal, said he would keep the school open all night long, every night, because he said he was not going to lose another child on his watch. And those words have stayed with me ever since. Quel pays regarde ces jeunes désespoir?
What country can look at these young people in despair without acting? What kind of country would see the wings of these young people be cut?
As young people are dying and doesn't send in all the support necessary, and then to learn the lessons, to say, we can change this. How is it possible we can have these patterns again and again and again without putting in place a coherent response? So I want to say again, from my region, and the region that I represent, where we've seen some of the highest suicide rates in the world, I've seen the potential of young people to transform this nation, and every time we lose a young person, we are losing the future of our nation. Sheridan Hukama, Deandra Anderson, Chantel Fox, Jenna Roundsky, Jolyn Winter, Azrea Kokapanes, Emily Ellison, Amy Owen, Kanina Sue Turtle, all who we've just lost in the last few years. And I want their names on the record, Mr. Speaker, because those children were loved. And we are here to tell their families and their community that they did not die in vain, that we have an obligation to work together to ensure the young people like Amy Owen, who wrote on Facebook that life was so hard she couldn't go on at age 12. That's not the Canada that I want to be in. That's not the Canada any of us want to be in. We, as a parliament, can make that difference. So we have models, but what we need to do is we need to, first of all, establish a community-based response that is culturally understanding of the various realities in our country. The last thing we need is another Health Canada program with posters. That will not change anything. We need to be empowering and ensuring that the grassroots organizations, the cultural organizations, the Indigenous organizations are at the table to say what they need, because they know what works. That would be a big step along the way of making change. What we also need to do is we need to develop national evidence-based test best practices. We are not having to invent rocket science here. There are organizations, mental health organizations, Indigenous organizations that have worked out and know what needs to be done, but they need a partner, and they need a willing partner. We need to talk about how, and raising awareness about how coverage of suicide in the media is dealt with. Because, you know, they said that suicide rates increased 10% in the United States after Robin Williams' death. We need to talk about media. We also need to talk about bereavement and families who are left on their own, who have no one to talk to. Because the fundamental difference, Mr. Speaker, between suicide and other health crises is that suicide is like a psychic shockwave that goes through a family, it goes through a community, it goes through a school. Its lingering effects are for life. And we've seen, particularly in the far northern communities, when we don't respond with a coherent strategy, that psychic shockwave has echo effects. And so we start to see, especially in young people, imitative behaviors that are incredibly destructive. We need a national online resource hub in the multiple languages to reach people. That's something that the federal government could do. We need to have a set of national training standards for people who are engaged in suicide prevention work and those who are wanting to know how to help, so that we have better protocols and it's easier to access those protocols. But the other thing we need to do, Mr. Speaker, is we need a coherent set of numbers. Because if I said to you, Mr. Speaker, that 11 people die every day in car accidents, you'd say, well, that's terrible. People should drive more safely. 4,000 plus every year die in car accidents. You should drive more safely. And we use those numbers about suicide. But if we started to point out, and we got the evidence to say, they're not just dying at random, there are pressure points. And if you said in a car accident case that a number of people died at one crosswalk, you would go down there to find out what was wrong. Absolutely. Without the statistical evidence and the coherent strategy, we don't know where to put the resources in play. For example, I was absolutely shocked when I was doing my research that the highest numbers that we were coming across were in middle-aged men. Well, why is that? Nobody was talking about that. And I know of many mines that I've talked to and lumber workers, and when a mill shuts down or a factory shuts down, people anecdotally will say, yeah, and then they started to die. If we looked and identified the risk in advance, we could start to reach out to those men. And we could start to have the programs in place so that those who are losing their jobs in times of transition are not on their own. This is what evidence gives us. Evidence gives us a focus and a way to move forward. And that's something that the federal government can do. Now, Mr. Speaker, I've been at this business in Parliament and honored to do this for many years. The one thing I've come to realize is that government gets up, hugs you, says it's a wonderful motion, it's dear to our hearts, and then nothing ever happens. This is why the motion is calling on the federal government that they have to do a regular progress report to Parliament. If we have the progress report on the numbers, on issues of identifying factors such as child sexual abuse, if Parliament is obligated, the government is obligated to present to Parliament an annual reporting, then we can begin to see how we're making a difference, and if we are making a difference. And where we're not making a difference, we can start to ask the questions why. That was the real beauty of the Quebec model, that they began to say we can change this by identifying where the problems are and putting resources there. We are the only G7 country without a national suicide action plan. It astounds me that in Canada, which again, it depends where you go, but in some regions of our country, we have the highest suicide rates in the world. And yet every single time a number of young people die, the best you get is a tweet from a minister saying it's a tragedy. It's not a tragedy. It's preventable. I saw this in the Attawapiskat crisis. We saw it in Escandaga. We saw it in La Loche. We've seen it again and again and again. A tragedy is when a child walks out and gets hit by a bus. But when a pattern is repeated again and again and again, we have to ask ourselves what's causing that pattern. What are the numbers? For example, in the far north, we did not have the on-the-ground proactive teams that limited and diminished the risks to young people. We did not have access to mental health services. We did not have any understanding or any way to find out whether child sexual abuse was a factor. We needed that in each one of these cases. So I think that I would like to say, Mr. Speaker, that we have gathered across this country support. The Canadian Association for Suicide Prevention has been doing incredible work on this for years. They've been asking for this strategy. The Canadian Medical Association is with us. The former the Regional Chiefs of Ontario, the Canadian Indigenous Nurses Association, the Canadian Nurses Association. I want to pay special tribute to ITK, Inuit, Teparik, Kanatami, and Nathan Obed, their president, who established a plan for the Inuit. And they are getting really good statistics and numbers so they can start to identify the problems. I want to give a special thank you to Jack Hicks, who approached my office, and Jack has been one of the frontline advocates in getting a strategy for suicide prevention, and he came to us during the horrific suicide crisis in Wapakika, when we lost Chantel Fox and Jolyn Winter and Jenna Roundsky, and that the trauma of those deaths led to numerous other young children or young women in that far north of Treaty 9, and he said, why are you guys not putting in place this national strategy? And we were overwhelmed dealing reactively, and he said, it's time Parliament reacted proactively. And so I come to you, my colleagues across the political spectrum, I come to you saying that as legislators, as adults, as parents, as the people who are supposed to be the voice of Canada, we need to start talking about how we address this horrific crisis that is causing so much pain, so much devastation. And for any person that we lose, we are losing the future of our nation, because I look in the eyes of young people and think, how could you give up? How could you not believe that this nation is there for you? If we're not there for them, we have failed. And this is our opportunity in the dying days of a parliament that's been pretty fractious, a parliament that perhaps has not lived up to the promise that, Canadians expected of it, but we can do something in the final days of this parliament to say, together, we are going to put people first, and we're going to start to talk about how to deal with the horrifying crisis of suicide. Thank you, Mr. Speaker.
Bravo.